My name is Emery M. Moore Jr., and this is Exercise and Movement Technique. We are continuing the conversation today with Dr. Martha Eddy, the founder and director of the Center for Kinesthetic Education. Please join us as we continue the conversation on somatic exercise, movement training, and education. Another thing that's interesting for me with this kind of work is it's a very individual. It celebrates the individual. It does not assume that there's a one-size-fits-all. And this has bothered me from the moment I started teaching in health clubs, because when I got out of college, there was nowhere else to teach. There wasn't any fitness. Now we have degrees in fitness. Now we have the fitness industry. There wasn't any fitness industry. And so we were making it up as we went along. And if you wanted to make a living, if you were, I wasn't a dancer per se. I had studied dance, but I'm a mover.
Yeah.
So where do you teach?
Right.
Where do you go to make a living? And we were able to go into these clubs, but then I was hit with this wall of this whole other side that I hadn't been exposed to, with people who are developing their bodies for the outside.
Yes.
And I had never encountered that before, because previously with dance, with martial arts, with Pilates, with yoga, with fencing, with all these other things, it was about what could you do. And now I was faced with people who were not interested really in developing an ability so much. It was, well, I want this to be a little longer. I even had people ask me, is it possible that they could decrease the width of their shoulders? And I would sit there and I was like, for real? I wouldn't really know what to respond. I was like, are you kidding me right now? I was like, you do realize those are bones?
And they have a size and a shape.
That's kind of like beyond the scope of what we're doing here. You know, I think that might even be illegal some places.
So I hear two things in what you're saying. One is the motivation for that outer look, and the other is even this motivation for a goal,
right?
Which is could be outside of yourself. And the somatic work will take you to either of those places. It can help you, support you look as good as you are,
right?
And it can help you achieve a better goal. But it can also be for just personal pleasure, to pay attention to your own body, to align yourself so you're without pain, is a key reason that people do this work.
Well, I found that some of my best students were people who I met through a therapeutic connection. They came with a disability or a problem that they wanted to get better. I also found that older people are really attuned to learning, because what we're talking about now is an education about yourself.
Yes.
You can't really do these kinds of disciplines without actually learning the how and why of it. You're not really something where you can sit on a bicycle and watch the television and the time goes by and it's like, oh, I gotta go and jump in the shower. You really have to be present. Even in the health clubs, I would discourage people from watching television when they were doing the cardio. It's like you're not paying attention to yourself. It's like you just came from an environment where you weren't paying attention to yourself. Now you're not paying to yourself. So the entire lifespan that you're doing is basically ignoring the signals that you're getting from what's going on. You're not sitting properly, you're not breathing properly, you're not relaxed enough, and you're not going to get the same benefit.
I mean, that is one of the challenges of the difference between being in a gym on a treadmill and running, because running, you don't necessarily have to pay attention to yourself the whole time. You could also be noticing the people going by or the trees that you're passing by in the park. So we want that balance of inner and outer focus. That's a key principle. And in the gym, unfortunately, there's less stimuli passing by as you're running, so the television sort of kind of eats that time up. But I like to position myself at least by a window, so there's something going on to pay attention to.
It's the motivation. What I personally try to instill in people is that a treadmill, a bicycle, any of the cardiovascular machines, really even most of the strength training equipment, is trying to mimic something in nature. Is trying to mimic something that we used to do, that our modern environment has taken away those things that it was arduous before. People had to carry water from the well, people had to chop, people had to lift, people had to lower, and they had to do it right. Because if you didn't do it right, you couldn't continue doing it. So it was literally life-threatening. And so we've gotten away from that in this particular society, in societies where they still have to do those things. you suggest going to a gym and they would look at you like you're out of your mind. You know, I'm like, go to a gym. You know, my life is a gym, and
That's right.
I respect that. Also, I'm trying to instill in people now that you don't have to go to a gymnasium to be fit. You can alter things in your life so that you put more movement in your life and put more awareness in your life, and you can enjoy it more.
Yeah.
Because the lack of motivation is because a lot of us don't want to just go around in circles. We don't want to just literally run and not go any place. Because as human beings, we do have, we like some stimulus.
Yeah,
And we like some
learn.
scenery and
Yeah.
something that's pleasant,
The
and also
aesthetic.
right, and also the challenge on our bodies is different. If you're running on an uneven surface, your nervous system is picking all these things up.
Exactly.
The muscles are firing. You're challenging your balance. You're strengthening aspects of your skeletal system and things that aren't going to be done on a completely flat surface where
It's
you're
regulated.
just lifting and lowering your feet. You know, there's no thrill. So I know we have to wrap up. I would love to talk to you longer, but I always like to ask this of people who you never see older people in fitness.
Ooh, that's an interesting question.
And so, what are we?
Well,
Because I'm over 50.
I mean, I would like to share with you, and I have only some of my older flyers, but if you look at the folks in these pictures from Moving
Show
on
it to the
Aerobics
camera,
and
if you can get it.
Moving for Life, most of my folks are over 50. Many of them are 60, 70, 80. And that in particular is a program for people with cancer, so movingforlife.org. However, I also have taught at Senior Planet. I don't know if you know about Senior Planet, but
No,
it's
it
a new
sounds
research
nice, though.
center. Yeah. And there are
Senior
just
Planet. I'd like to go to Senior Planet.
you
one day.
would. It's actually a technology center. It's where any person over, I believe, 55, but certainly 65, can go in and learn a lot about how to use technology. But they have a big, beautiful movement space, and I was there for V-Day, teaching the V-Day choreography and
Wow.
Moving for Life lesson. And they really got it, and a lot of those folks are going to be joining us at the dance parade this Saturday.
Okay.
So, especially as we all know, the demographics are such that more people are going to be older than younger
Yes.
as these years continue. We all have been since the 70s more aware of the importance of aerobics and more aware of the importance of movement.
Yes.
I think you're going to see more and more of the aging population choosing to exercise in a really holistic way.
I hope so. I hope we see it represented in fitness.
I think so.
I hope we see the programs that are age appropriate in that they're not looking at seniors as being unable to do.
Yes.
Because some things are not stimulating enough. You know, people who are very active for all of their life. Some of the programs I see just to me are not appropriate.
Oh, you're just sitting in a chair, kind of boring. Yes.
Right.
I would really encourage everybody to check out movingforlife.org because, yes, because people are at different stages in their life, maybe because of injury, maybe because of illness, maybe because of some kind of rapid aging process. We do have a seated version of our program, and people will sit one week and then get up the next week. So people are accommodating to what's present, as you said, being able to be present in the moment, not assuming just because I did it last week one way, I'm going to do it the same way this week. And yet, there's always that option to go faster, go deeper,
That's
go
wonderful. bigger,
and that's constantly we're describing. We're describing how if you're out of breath and you're not able to talk, then get smaller. Go
Right,
slower.
you're paying attention to yourself. Well, everybody, we have to go. Thank you so much.
Really a pleasure.
Yes, same
Great.
here.
Yeah.
And maybe I can come back again and we can talk about some other things.
I hope so. Yeah,
Thank
we
you
can
so-
work out in my studio moving furniture.
Yes.
Thanks.